Welcome to our channel, Equation by Pharmacist Moms. We hope that you all are doing well and ready to learn something new with us today. July is the awareness month of hemochromatosis, and that is our topic for this video. What we will discuss about hemochromatosis is here. What is hemochromatosis? What are the signs and symptoms of hemochromatosis? How hemochromatosis is diagnosed? How hemochromatosis is managed? Let's begin. What is hemochromatosis? Hemochromatosis is the abnormal accumulation of iron in parenchymal organs, leading to organ toxicity. It is the most common autosomal recessive genetic disorder and the most common cause of severe iron overload. What are the signs and symptoms of hemochromatosis? Patients with hereditary hemochromatosis may be asymptomatic in 75% of cases, or may present with general and organ-related signs and symptoms. Early symptoms include severe fatigue in 74% of cases, impotence in 45% of cases, and arthralgia in 44% of cases. The most common signs at the time of presentation are hepatomegaly in 13% of cases, skin pigmentation, and arthritis. Clinical manifestations of hemochromatosis include liver disease including hepatomegaly in 13% cases, cirrhosis in 13% cases, usually late in the disease. Skin bronzing or hyperpigmentation in 70% cases. Diabetes mellitus in 48% cases. Arthropathy. Amenorrhea. Impotence. Hypogonadism. Cardiomyopathy. Osteopenia and osteoporosis. Hair loss and koilonychia. How hemochromatosis is diagnosed. The diagnosis of hemochromatosis is based on clinical features of the disease. Most patients are asymptomatic and are diagnosed when elevated serum iron levels are noted on a routine chemistry screening panel, or when screening is performed because a relative is diagnosed with hemochromatosis. Laboratory studies used in evaluating suspected hemochromatosis include: First one is genetic testing. Examination of HFE mutations, including C282Y and H63D, is vital for diagnosis of hemochromatosis. Second one is blood tests. Blood tests include serum transferrin saturation levels. This test measures the amount of iron bound to a protein transferrin that carries iron in the blood. Transferrin saturation levels, greater than 45%, are considered too high. Serum ferritin studies. This test measures the amount of iron stored in the liver. If the results of serum transferrin levels are high, physicians advise serum ferritin test. Liver function tests. These tests help to identify the liver damage. Next are imaging studies. These include chest radiography and echocardiography. Chest radiography and echocardiography may be helpful in the evaluation of patients with hemochromatosis and cardiac disease. Electrocardiogram or ECG. Supraventricular arrhythmias are often revealed on ECGs. Computerized tomography or CT scanning. CT scanning is neither sensitive nor specific for the detection of mild hepatic iron overload. Magnetic resonance imaging or MRI. MRI may be more sensitive than CT scanning, but this modality has not been validated as a diagnostic test to help confirm hemochromatosis. Hepatic iron quantification with MRI might be helpful. These are some procedures that may be used to assess patients with hemochromatosis, including diagnostic endoscopy, skin biopsy, liver biopsy, with biochemical determination of hepatic iron concentration and calculation of the hepatic iron index, and histologic evaluation with iron staining, with pearls Prussian blue. What are the indications for liver biopsy? Let's discuss. The use of liver biopsy in hereditary hemochromatosis can be restricted to those patients with a high probability of severe fibrosis or cirrhosis. The American Association for the Study of Liver Diseases, that is, AASLD guidelines, include these indications for liver biopsy. All homozygotes with clinical evidence of liver disease. All homozygotes with serum ferritin greater than 1000 nanogram per milliliter. All homozygotes older than 40 years with other risk factors for liver disease. Compound or C2A2Y heterozygotes with elevated transferrin saturation, particularly those who have had abnormal liver enzyme levels or clinical evidence of liver disease. How hemochromatosis is managed. Clinical suspicion and early diagnosis are essential in hemochromatosis. The goal of therapy, in patients with iron overload disorders, is to remove the iron before it can produce irreversible parenchymal damage. Once diagnosed, hemochromatosis is treated by phlebotomy to rid the body of excess iron and to maintain normal iron stores. Phlebotomy remains the sole recommended treatment for hereditary hemochromatosis and should be undertaken in a case-specific manner. In patients with hemochromatosis and heart disease, anemia, or poor venous access, treatment with iron chelation agents is recommended and includes these agents: deferoxamine, deferoserox, deferiprone, and iron-binding dendrimers. Surgical procedures are used to treat two important complications of hemochromatosis: end-stage liver disease and severe arthropathy. Orthotopic liver transplantation is the only therapeutic option when end-stage liver disease progresses, despite iron reduction therapy. This intervention is also indicated in cases with the development of hepatocellular carcinoma. Surgical arthroplasty is considered if joint destruction becomes severe despite medical therapy. Hemochromatosis is a common disease that causes too much storage of iron in the body. Although it is a serious problem, but it is treatable, especially when diagnosed early. Talk to your family physician if you have symptoms of hemochromatosis or have a family history of it. We hope that you like this video. Don't forget to subscribe the channel for more informative videos. Thank you.